Hi, Dave with Align Therapy here again. I wanted to talk about the spine and how cool it is, but I also wanted to talk about what the spine is not able to do and how much weight it's not able to support. I get a lot of patients who come in with scoliosis specifically, or other spine deformities, that they feel like their spine is fragile, or they feel like their spine is going to collapse underneath them. I have some parents who come in with teenage patients who they have scoliosis but they don't have back pain, but their parent has restricted them significantly in what they can do. That they shouldn't jump on the trampoline, they shouldn't crack their back and things like that because it might damage the scoliosis or make it worse. I'm here to tell you that those things don't make scoliosis worse. And in a lot of ways, we actually want loading of the spine. We want mobility of the spine. So some of those things are actually good things to do. If we look at the spine out of the body without muscle support, if we load the spine, like it doesn't take much weight. Like if I put this 10-pound weight on top of the spine without the muscles to support it, it would collapse under the weight. So the spine by itself isn't necessarily the most stable of things. It has a lot of ligament tissue, it has a lot of things that are helping to stabilize the spine, but by itself it does not have that much stability. We have to have the muscles supporting the spine. We have a ton of muscles around the core, a ton of muscles around the spine to help support the structure that we call the spine. And unless we have those muscles working in concert together, we get back pain, we get deformity, we get things like that. And so rather than avoiding things, I mean, there are things you should probably avoid if you have a significant scoliosis curve. We're not going to go into that in this video, but the spine isn't fragile. It's not something that we need to really back off of unless you have way advanced osteoporosis. The spine needs stress to stay strong and for the muscles to stay strong and stabilize. So if we take all of the muscles away and things atrophy, then a little bit of weight is going to compress the spine and create problems. So with my patients, I'm an advocate for activity. I want you to be active. Activity helps to activate the muscles that are around the spine. It helps add stability to the spine. It helps to reduce pain because we get the muscles working how they were designed to work. In our society, we have a lot of sitting and we have a lot of laying down, and the muscles aren't needing to support the spine with that. So being active is very helpful for that. So as far as the bony structures, we also need compression to help the spine to stay strong and stable. The bones need that stimulation to make more bone and to keep the bone that we have, especially in osteoporosis and things like that. We need stability from the muscles, we need strength in the bones, and we have to have that through some stress on the spine. Our bodies adapt to the stress that we place on it. So your spine is not fragile. Most spines are not fragile, and activity and strengthening is very important to keep the spine stable. So if you have concerns about your specific spine, I would suggest seeing a therapist or a doctor who has experience with your problem, whether it be scoliosis or kyphosis or general back pain. But activity is good for the spine. The spine is not a fragile thing if you have scoliosis that's just going to crumble if you don't baby it. We don't need to just swim because it's low impact. Those types of things are kind of myths that we're finding that aren't true. So hopefully this helps you to get an idea that you should be active. Active within reason. I mean, if you have other aches and pains, we should be mindful of those. Consult with a specialist that knows your problem and get active, get those muscles strong, and stabilize your spine. So thanks for watching. Subscribe if you like what you hear, and we'll see you next time.